Thank you for joining us for this edition of BlackHealthMatters.com, brought to you by Bristol Myers Squibb in conjunction with Kappa Alpha Psi Fraternity Incorporated. I'm Spencer Pryor, Vice Polemarch of the Charleston Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated. In this edition of BlackHealthMatters.com, we're focusing on prostate cancer and clinical trials. Straight talk about your prostate. Joining me to discuss this topic is practicing physician Thaddeus John Bell. Dr. Bell's family practice is located in North Charleston, South Carolina. He is also the founder and CEO of Closing the Gap in Healthcare Incorporated. He is a distinguished graduate of the Medical University of South Carolina State University. He's a former flight surgeon with the United States Air Force, a fellow American Academy of Family Medicine. He's a retired Associate Dean of Diversity at the Medical University of South Carolina, a life member of Omega Psi Phi Fraternity Incorporated, and the list goes on and on. Let's welcome Dr. Thaddeus John Bell.
Thank you very much, Spencer. I'm happy to be here with you today.
Sure, Doc, glad to have you. And listen, we're going to keep this kind of casual. We know each other. We've known each other for over 30 some odd years. So it's a pleasure for me to actually be interviewing you and talking about such an important conversation to have here.
Thank you very much.
Sure.
I think we'll have fun with this topic.
Absolutely. Listen, I talked a little bit about, of course, your accomplishments. They go on and on and on. But I just, kind of scratched the surface. But one that's important to me is the work that you've been doing in closing the gap in healthcare, because I know it concentrates a lot on health and health education initiatives. So take a few minutes and just let our audience know a little bit about yourself, what you're doing, and about closing the gap in healthcare.
Well, thank you very much. I've been practicing medicine now for about 45 years. Doesn't seem that long, and my practice is mostly African-American men and women. I've noticed that over the past 5 years, my practice is mostly African-American men. Closing the Gap in Healthcare is an initiative that I started about 17 years ago. And the primary purpose of Closing the Gap was to increase the health literacy of the Tri-County area here in our state. So we deal with all of the health disparities, prostate cancer being one, but we deal with about 10 health disparities that affect African Americans and the underserved population. So we've been very successful in doing that. We are an award-winning program, and so we do these kind of programs often.
Very good. That's good. Well, listen, let's dive into this because, like you said, this is an important and an interesting topic here. Straight talk about your prostate. When we talk about prostate cancer and all, there's so much that's to it. And one of the things is I notice, we hear folks say prostate cancer, but a lot of times we don't even know what it is. What is the prostate? So let's kind of get right down to the ABCs, should I say, of it, and talk to us, tell us about the prostate, what it is, how it works, all that good stuff.
Okay. Well, first of all, I want to let folk know that I'm going to talk to you about prostate cancer from a physician's point of view, but also let you know that I'm a prostate cancer survivor. So I can give you some insight as to the anxieties and the fears that Black men have when they get that diagnosis. On the screen, you will see the anatomy of the prostate. And of course, this particular prostate has a tumor in it, prostate cancer in it. And you can see that the tumor is, you can see the tumor because you can see the white tumor-like looking mass in the prostate. The prostate is a gland about the size of a walnut, and that it sits directly behind the rectum, and it sits on top of the urethra. Now, this is very important to recognize because when one develops prostate cancer, The urethra is oftentimes affected. And by that, I mean the symptoms that the patient will oftentimes have will be a decrease in the ability to urinate, difficulty urinate, sometimes urinating too fast, sometimes seeing blood in the urine. So these are symptoms that are related directly to prostate cancer. But here's the one thing that I want to remind people. Most of the men that I have seen in my practice, Spencer, have not had any symptoms of prostate cancer whatsoever, have not had any symptoms. So that is why it is very, very important to do the prostate screening, which we'll talk about as we.
So, Doc, that's a good lead into my next question. When we talk about prostate cancer and among Black men, let's talk a little bit about statistics themselves. You know, what do we see, and how do Black men line up when it comes to prostate cancer and statistics?
Well, prostate cancer is the second leading cancer that African American men have. African American men are twice as likely to die from prostate cancer because by the time the diagnosis is made, it is often very, very late. So that is why, in fact, we are doing this program, because we need to let African American men know that even though their doctor may not encourage them to get screening, because the prevalence of prostate cancer is so high among African American men, if you're 40 or above, you really should be getting screened for prostate cancer annually.
Yeah, and I also, I see where there's some statistics as, more likely to be diagnosed with a more aggressive form of prostate cancer. Black men are more likely to be diagnosed. Talk a little bit about that.
Yes, well, one of the things that I want to, I think is very, very important for Black men to understand. When prostate cancer, when that diagnosis is made when you're in your 40s, that cancer is more than likely to be very, very aggressive. As you get older, prostate cancer does not appear to be as aggressive as it is when you are very, very young. That's why I recommend that all Black men make sure that they get screened starting at age 40. And here's the other thing, Spencer, that is not often talked about, and that is, we know that prostate cancer runs in families. So therefore, it is important for African American men to ask their father whether or not they were ever diagnosed with prostate cancer, or ask whether or not they had a brother who was diagnosed with prostate cancer, or uncle who was diagnosed with prostate cancer, because we do know prostate cancer has a tendency to run in families. And I can't tell you the number of stories that I've heard when I encourage the Black men that I see, the young Black men that I see, to go back and ask their father whether or not they had, or whether or not they heard of or had prostate cancer. And the answer to that question will oftentimes be yes.
Mm-hmm. And when we talk about African American men versus white counterparts, is there a higher risk for African American men?
It appears as though prostate cancer is more prevalent in African American men. We do not know the answer to that because there are also studies to show that that seems to be the case in the United States, but that doesn't necessarily have to be the case over in Africa or South Africa. So we don't know why African American men are more at risk. We have some soft data to suggest why it may be the case, but it's nothing that we can lay our hands on. We do know that some risk factors for prostate cancer is eating poor food, being significantly overweight, having other health issues that are oftentimes not taken care of. Leading a sedentary lifestyle is also, a risk factor for prostate cancer. But these are all soft, what we refer to as soft data. So the bottom line is, as of yet, we do not have the answer to that, to that question.
Okay. Well, you touched on a little earlier about symptoms. I want to talk a little bit of some symptoms, and then into screening what we can look forward to on this. So initially, you said it could be if you're urinating too much or whatever. And so talk a little bit again about the symptoms that one can expect to come on when it relates to prostate cancer.
I think that's very, very important for us to talk about, Spencer, because as I pointed out, most of the men that I make the diagnosis in with prostate cancer have no symptoms, nada, no symptoms. The way that we find out is that we do that PSA. However, when symptoms do occur, those symptoms can be blood in the urine. Those symptoms can be urinating a lot. Those symptoms can be oftentimes having difficulty urinating. And here's the other thing too, Spencer, that is not often talked about. But when young men all of a sudden have erectile dysfunction, that is a reason to look for prostate cancer or other conditions of the prostate. By the way, I should mention that there are other conditions of the prostate that affect men as they get older. One of them is called prostatitis, which is inflammation of the prostate, and the other one is called BPH, benign prostatic hypertrophy. That's when your prostate begins to get larger as you grow older and causes you to have difficulty urinating or urinating too much, and etc. But those are benign conditions. Prostate cancer is what we are focusing on today. Now, when we are looking at the screen here, there's something that I want to point out that you and I have talked about in the past, and that is this. The colonoscopy and the prostate exam are two entirely different things. Colonoscopy is done by the gastroenterologist. That is the doctor who is concerned about colon cancer. And while he inserts a colonoscope up your rectum to look at your colon, he is not checking your prostate. And then, of course, when the urologist does a rectal exam, a DRE, a digital rectal exam, he is feeling for your prostate. And by the way, Spencer, when the doctor does a digital rectal exam, what he is feeling for is how your prostate feels. And usually that prostate is in directly or can be felt with the finger being inserted in the rectum. And if you take your finger and do it like this, and you feel the softness of this tissue here, that's the way the prostate is supposed to feel. Now, if it's large or if it's lumpy or bumpy, that suggests that something may be going on with the prostate. And that's when your primary care doctor usually sends you to the next level.
Yeah. So Doc, I wanted to talk. I know when we were talking about the types of screening on that. There's, some folks just think that it's either just the doing the rectal exam, or is there the PSA type? I've heard, kind of combination. So let's talk about the types of prostate cancer screening.
Well, that's an excellent question, and I'm going to explain to you that the prostate, Spencer, secretes a hormone called the prostatic specific antigen. That's where the name PSA, that's the acronym for prostatic specific antigen. And when that hormone goes up, and there is, by the way, there's a norm that PSA should remain at, and is based on age. The normal age is from 0 to 4, and then with each decade, the number can change. But when that PSA begins to go up, that's suggestive. It's just a red flag that something may be going on with the prostate. It does not, I repeat, it does not make the diagnosis of prostate cancer, but it's a red flag that something is going on. Now, here's the other thing, the digital rectal exam. That's the exam that we all hate. That's the exam that has caused a lot of Black men not to go in and get evaluated. But it is an important exam. But I can tell you that recently the digital rectal exam has come under some scrutiny. Some doctors feel that it's not necessarily an exam that they need to do. However, I still do it, and most urologists will still do the DRE, the digital rectal exam.
Because that's what I was going to ask you, Doc, if you could probably talk a little about that. So are you able to distinguish if you get the PSA test, you don't have to do the digital rectal exam? Should you do both of them? Or what leads you to say which one is the best for you?
Well, what I usually do when I'm seeing a male for the first time, I will do the digital rectal exam, and I will also do the PSA. By the way, the PSA should be done annually. If the man does not have any symptoms, then I will do an annual PSA, and I will not do the digital rectal exam. But if he comes in and if he has symptoms, I will do both. All right. So it just depends on the patient. But I can tell you that if you get referred to a urologist, you can get prepared to get a digital rectal exam, because most urologists feel very, very strongly that the digital rectal exam plays a major role in helping them to assess whether or not something is going on significant with your prostate.
So, Doc, I know, you shared, this is personal, you've shared, your bout with prostate cancer and the importance really why you're here today to let other folks know. So talk a little bit about that, and sometimes while folks are hearing this come, and particularly from a doctor, because sometimes folks will think, oh, a doctor's never get sick, or, oh, a healthy person like yourself would never, get sick. So talk a little bit about that.
Well, thank you very much. I appreciate the opportunity. From a family health perspective, my father passed away at age 57. I do not know whether or not he had prostate cancer. He died before I went to medical school. So if he had anything wrong with him of significance, he would have told me, because he was just that kind of guy. But I only point that out for people to understand that if you're fortunate enough to still have your father in your life, your biological father, then you definitely want to ask him whether or not he's ever been diagnosed with prostate cancer, because we do know that prostate cancer runs in families. All right. But I got diagnosed very early. I think I was in my early 50s. It came as a big shock to me because, number one, I was having no symptoms, no blood in my urine, no problems with erectile dysfunction, no problems with hesitancy or frequency. That means, going to the toilet bowl, standing there waiting to urinate, or going a lot at night. I was not having any problems like that. So I went to a conference and of doctors, of Black doctors, and they were checking the doctors for prostate cancer. And so I decided that I would submit to a rectal exam and to getting the blood work drawn. And about 2 weeks later, I got a registered letter from the National Medical Association giving me my results, and it recommended that I should continue to monitor my PSA closely, which I did do. But when it got to the point where it was like 3.5, okay, and before being the higher end of normal, I decided that I would go ahead and see a urologist. That's a guy who's a guy, a male or female, who specializes in treating the prostate. So I went to the local university here. I knew them very, very well because after all, I was referring a lot of patients to them. And of course, to make a long story short, we did a biopsy. That's where they stuck a needle in my prostate, and the biopsy came back positive. And so we had to make a decision as to where to go after that. And so I elected to have hormone treatment. And hormones is a way of lowering your testosterone level to keep the cancer from growing so fast. And I had an interesting reaction, so I had to stop the hormone treatment. But I had enough of it to stop the cancer from growing. So for about 3 years, my numbers just stayed right there. And so that's where I went under what we call active surveillance. But then my doctors did some other tests, and they said, look, we recommend that you also do radiation treatment. You're probably going to do all right, but we recommend that you do radiation treatment. So I did, I think I did 21 days of radiation treatment. And so now I'm in remission. I just saw my doctor yesterday. I feel good. And I'm going to continue getting followed up and continue being a good patient.
Man, that's awesome, especially to hear that coming from a doctor. But no, you touched on kind of what I was going to lead into next was when you get a diagnosis, sometimes that's the most, not sometimes, it could be the most devastating news that you could get them. And some people tend to just say, this is the end. The end is here. There's nothing. So can you talk a little bit about therapies, what's out there? And I know, as you were saying, you were able to get radiation treatment, or there was something else. What are the therapies so, folks can know that, yep, even though this is serious, there still there are still options out there?
One of the things about going to a medical university, when you go to a medical university, you get a chance to get seen by urologists who will look at your situation and come up with the best modalities of treatment for you. Excuse me. I need to let everybody know that everybody's prostate cancer is different. Okay, so what's going to be recommended for you may not be recommended for the other person. It was recommended for me that I try hormone treatment and radiation treatment. I did not want to have surgery. The other thing that I want to remind men, we don't talk about this enough, and perhaps at another time we can talk about it. But yes, I was concerned about whether or not I was going to be able to have erections after getting diagnosed with prostate cancer. So that's another issue, and that's another reason that oftentimes African American men do not want to be diagnosed, and the anxiety level with reference to prostate cancer is so high. And that's another reason why the wife should be involved.
So, Doc, thanks so much for that. And I know, when we were talking about therapy, or you were talking a little bit therapies, I know you talked about yours, the observational and being under active surveillance. So I'm sure there are other types of therapy. Can you run down a little bit of that? Surgery may be one. What else is out there? So do I see my general practitioner, or do I see, what doctor? People can be confused about who they should see when it comes to prostate cancer. So let's talk a little bit about the physicians. Who should someone be going to?
Excellent question. That's why it's very, very important for African American men to have a primary care doctor. That's the doctor who will most likely initially make the diagnosis and refer you to the urologist. And the urologist is the subspecialist that will further evaluate you. He will be the person who will probably do the biopsy and the MRI and etc. And then when those tests come back and it comes back as cancer, then he will refer you to the oncology urologist. That's the cancer specialist for the prostate. And that's when they will look at your situation, and then a lot of different doctors will look at your slides and they will make a decision as to how you should best go forward with your treatment. And that's when they will call you in. And by the way, I recommend that when they call you in and they sit down and they talk to you, if you're married or have a significant other, bring that person with you, because this is a very, very trying time. There's a lot of anxiety. Half of the things you don't even hear that the doctor is saying, because you've gotten this horrific diagnosis and you're frightened and you're anxious. And this is why I recommend that you bring in your significant other. And then you can pause. You can pause and say, you know what? I'm going to go back and talk to my primary care doctor about all of the things that you all have told me about. And so your primary care doctor can go over with you based on the information that he has gotten from your urologist. And then the two of y'all or the three of y'all can make a treatment plan going forward. And I think that that's the best way to approach it.
That's good. Well, let's kind of switch gears and talk about, when we hear, which is sometimes, and we have to be upfront and honest when we talk about it in the African American community, when we hear the word clinical trials. And we need to kind of debunk the myth about, oh, we shouldn't be involved. So first, let's talk about why clinical trials are important, and then how should we get involved in clinical trials?
Well, first of all, having worked in an academic setting for a great part of my professional career, I believe in clinical trials. Just by way of history, though, I want to let you know that African Americans have not always been welcome to clinical trials. All right. It is only within the past 10 or 15 years that African Americans have been welcome to clinical trials, and that African American physicians have been invited to participate in clinical trials. But with that being said, that is not the case now. We know that we don't have enough African American men participating in clinical trials, especially considering the fact that prostate cancer is the second leading cancer that African American men have. Lung cancer is number one, but prostate cancer is the second leading cancer that Black men have. So if you get the opportunity to participate in a clinical trial, then you should inquire about it through your physician, or if you want to get further information, you can call the university that's in your town or in your city and ask them for the urology department, and you can talk to someone in the urology department who can refer you to the section where they're doing clinical trials. And I encourage Black men to do that, because it is only through the clinical trials that we find out what treatment modalities work for African American men. So that's the only way that we are going to find out.
Exactly, and then I know there are two websites that folks can go to as well, also, and get that information. Which bmsstudyconnect.com is one of them, and then clinicaltrials.gov. That's bmsstudyconnect.com and clinicaltrials.gov, and there's a lot of information that's there. And you're absolutely right. I think sometimes we have to get in, we have to do the research ourselves as well, also educate ourselves, make sure that we're connected with a physician that can also take us to that next level when it comes to educating us and treating us as well also. And again, it's just as you were saying, the importance of us getting involved is to our betterment.
Absolutely. One of the things that we want to point out is that we have found out that Black men oftentimes are not upfront and do not participate in getting prostate exams because they don't trust their doctor. And so trust, we have found in some places, is a major reason why Black men don't oftentimes talk to their doctor about prostate cancer. But I just want to make men know that while we don't know what causes prostate cancer, the bottom line is that the earlier the diagnosis is made, the better the outcome is going to be for you. And the issue regarding erectile dysfunction, there is just so much information that has come about as a result of men having their prostate taken out, because erectile dysfunction is one of the side effects, but erectile dysfunctions can be dealt with. So I just want to encourage my brothers to participate and get that prostate exam, get it checked out.
Exactly, I totally agree with you. And then when we talk about clinical trials, folks think that, oh my goodness, if I get in this, everybody's going to have my information. They're going to do this. So talk a little bit about who oversees like these clinical trials.
These clinical trials, the information is kept, but not, well, secret is not the word, but it's very, very confidential. No one will get your information. That information is guarded. That's all a part of doing the clinical trial. Oftentimes, what's going on regarding how well you are doing is not even known by the doctor, because that's a part of the trial. So I think that you can feel fairly confident that the trial is going to be done correctly. The institutional review boards, these are the oversight centers that look over clinical trials, look at the way that they're done. And people should be aware that if that institutional review board thinks that that clinical trial is not a good one, and thinks that it's inhumane, thinks that it's not moral, it will not certify that the trial be done. So I think that clinical trials are a good thing for African American men to consider.
That's awesome. I know we've got just a little bit of time left, but I wanted you to, if you could briefly just reemphasize again to the importance of having family members, or like you said, if you're a spouse or a significant other that's involved in there, that can sometimes, as men, we need that push to get us into the doctor. We'll say, hey, we'll be okay in a week or so on there. But what again is that importance of having that involvement?
That's very, very important. Spencer, I'll tell you a quick story, which I think drives home the point. Last year, I was following this young African-American man. He was about 50 years old. The year before, his PSA was 0.9, 0.9. The next year he came back. Actually, he didn't come back the next year. I had to call him in. And when he came back, we repeated his PSA. And it went from 0.9 to 9, from 0.9 to 9. No symptoms, none whatsoever. And of course, we got him evaluated. He eventually had to have robotic surgery, which he chose to have, and he's doing well. The other thing I want to remind men is that your overall health is, make sure that your overall health is good. That we don't know a lot about what causes prostate cancer, but we do know that men who are overweight and who are sedentary and who eat poorly, they are more likely to develop prostate cancer, and they're more likely to develop other cancers as well. So your overall health is very good. So be informed. If your doctor is telling you you don't need to have a prostate exam or a PSA done, tell him no, you want to have it done, because you know that that cancer is a leading cause of death in Black men.
Perfect. So, Doc, you see now when we talk about, like I said, our time is getting tight here now, but I want to wrap up with, in conclusion, what folks should know, and you were talking on them. So I know on your screen you'll see some of the fine points. So I'll let you run down those fine points there to let folks know, in conclusion, this is what they should be doing or should be paying attention to.
Screening is very important. You should get screened annually. Every year, you should get your PSA done, and you should have your doctor explain to you what it was last year, what it is this year. You should also continue to talk to your family members about about any history that may be in your family as it relates to prostate cancer. And then you should definitely consider participating in a clinical trial, even if you've been found not to have anything wrong with your prostate, because that way you can contribute to the body of knowledge that we need to have as it relates to Black men and prostate cancer.
And I can't say it enough, Doc, thanking you, but I want to give out those two websites again so folks can, go to and get more information as they, again, contact their physicians. It's bmsstudyconnect.com, bmsstudyconnect.com, and also they can go to clinicaltrials.gov to get some very, very important information. Hey, Doc, listen, this has been great, man, sharing this this stage with you. I've been deeply honored knowing you, like I said, for over 30 years, and just the great work that you've been doing in the community, not only in the medical community, but just in the community in general. And we really, really, really appreciate your contributions. Kind of a couple, maybe about 15, 20 seconds of a wrap up, what you'd like the audience to hear from you again.
Well, first of all, I want to say thank you to the folk who are responsible for this program. We definitely know that when we do programs like this, talking straight talk to Black men, they are more likely to get the evaluation done. And just keep in mind that prostate cancer can happen to any of us. And while we don't know what causes it, we do know that if you get evaluated early, and unfortunately you do end up getting diagnosed with it, it does not necessarily mean that you're going to die if you get the right things done at the right time.
That's awesome. That's a great way to end this. And I want to again thank our sponsor, Bristol Myers Squibb, in conjunction with the Kappa Alpha Psi Fraternity Incorporated, and of course the local chapter here in Charleston, South Carolina, the Charleston Alumni Chapter of Kappa Alpha Psi. Doc, I cannot thank you enough. This has been important. This has been enlightening. This has been educating. This has been everything, and we can't just stop here. We've got to continue to talk among ourselves and talk to our physicians so that we can stay healthy. I really, really appreciate this blackhealthmatters.com and the conversations that are going on, and I hope that we'll be able to share some more information at another time.
Absolutely.
Doc, thanks for your time, and thanks everyone for tuning in.